Well, good afternoon, everyone. Thank you so much for being here. I appreciate the people who have come in person, and to all those out there virtually, welcome. I appreciate you joining in. Again, it's great to see everybody. You know, it's truly an honor to be your president. I'm in my 6th year, and it's just amazing what we've been through in these last 6 years. And it's just an honor to be here, and I so appreciate all the support from all of you. My objectives today is to, go over sort of a review of where we are now and where we're going. Talk about our accomplishments, acknowledge all of you, because it's your work, and show you where we're really making progress, but also talk quite frankly about the challenges we face as an institution as we move forward into the future. So I want to start with, of course, our mission, and I'm going to do something a little bit different this time. This is a recorded version of our mission.
The mission of the West Virginia School of Osteopathic Medicine is to educate students from diverse backgrounds as lifelong learners in osteopathic medicine and complementary health-related programs, to support and develop graduate medical education training, to advance scientific knowledge through academic, clinical, and basic science research, and to promote patient-centered, evidence-based medicine. WVSOM is dedicated to serve, first and foremost, the state of West Virginia and the health care needs of its residents, emphasizing primary care in rural areas.
I want to give a big shout out to our AVP department. They're doing beautiful work. Yeah, I agree. They're just incredible. So when we look at our mission, so how are we doing? Well, I think we're doing pretty good. When you look at educating students from diverse backgrounds in osteopathic medicine, I'm going to talk more about this, but I applaud the faculty and the staff for creating a new curriculum, those staff that are involved as well, but the faculty creating a new curriculum. Creating a complementary health-related programs. Again, we're starting our first master program. Again, I applaud the work of Dr. Garrow and the faculty who are doing that. In terms of supporting GME, we had 100% placement rate. That's incredible. That's the goal, and we're meeting that goal. Expanding scientific knowledge through academic, clinic, and basic science research. Well, I'm really appreciative of the new energy in the research office and under Dr. Poneth, but also the $29 million appropriation from our legislature and our governor to build our research infrastructure. Promoting patient-centered, evidence-based medicine. Our clinical faculty are incredible. And yes, we have problems at RCBC, but we're meeting those problems head on. And then, addressing the healthcare needs and serving West Virginia first and foremost. We're the leading producer of physicians in the state. So when I look at our mission, we're really doing well. We're doing well, and it's because of your work and all of the work of all of us to move us forward. I showed this last year, and it's from 22 data that Dr. Ed Bridges put together. But those trends continue, and that's why it's important. And so the state measures, the Higher Education Policy Commission measures every year the production that each of the 3 medical schools, how they're doing. And they look at 5-year cohorts. And so Dr. Bridges mapped out that for the past decade. And the green line the green line here and here and here is WVSOM. The black line, I believe, is WVU, and the reddish line is Marshall. So what you can see is that in the top graph, WVSOM is the clear leader in providing physicians in rural areas of West Virginia, and we've been that leader for over a decade. The second graph is our production of primary care physicians who practice in West Virginia. Again, we are the clear leader in the state for over a decade. And then the bottom graph is overall production of graduates who stay in the state to practice in any specialty. And you can see again that we are the leader currently, and that continues. So here's the data for this year. And what you can see is that in all three categories, when you compare WVSOM to WVU and Marshall Medical School graduates, you can see we lead. And it's for this 6-year cohort period. So overall production of physicians for the state, look at our rural numbers. That is an amazing number. 81 new physicians in rural areas of this state. Really incredible. And then more than double what the other schools are doing, and then our lead in primary care. So again, we're serving West Virginia first and foremost, though we do it in so many other ways, and I'll point that out as well. We have a lot to be proud of. We're the largest medical school in the state. We have the lowest tuition in the state. And we'll talk more about tuition later in the presentation. And then we have a significant economic impact, especially when you add in the contributions, the healthcare hours worked by our students and by our alums in the state. So we are making a major contribution. And I'll tell you, as I go around the state, as I work at the Capitol with our legislature, they know who we are. They comment when that most people know me, but if they don't know me and I get introduced, this is the WVSOM president, they say, oh, you produce great graduates. You know, my physician is a graduate of your school. You're doing a great job. So I hear this all the time, and I just want you to know that, and that you're part of that success. Everybody here contributes to that success. And of course, you know, part of the success, what drives the success is leadership. And our success is about leadership. And so leadership is the key, I believe. And I think we have excellent leadership with our Board of Governors. We have Dr. Randall Belt, who is our current chair. He started in July. He's an alum of the school, ER doc, down in Tennessee. But originally from the Bluefield area. We have Dr. Fred Morgan, vice chair. Dr. Morgan is an orthopedic surgeon, practices at Princeton Community Hospital. And then we have our own Marley Kirby, who's our secretary, and serves very well in that position. I also want to point out 2 new members. Aaron Reese is our current student member. That'll change, and my understanding is Ethan Galloway will be our new representative, student rep on the board. And then Dr. Caitlin Santer also has joined our board, and she is an alum of the school, family medicine doc in the Parkersburg area. So again, we have excellent leadership in terms of our Board of Governors. We also have excellent senior leadership, and as you know, there have been a lot of changes this past year. We had the retirement of Larry Ware, people that have served this institution for a long time. Larry Ware, Dr. Ed Bridges, and Linda Arnold. Interestingly, when I came back from winter break last year, on the Tuesday that I came back, two of the vice presidents told me that they were retiring. Boy, that was an interesting day. You never know what's going to happen sometimes day to day. But, I think we responded in a really positive way. I really appreciate my VPs. The addition of David Meadows as our VP for Finance and Facilities has really been excellent. He's just been an excellent addition. Moving more responsibility on Dr. Hill as our Chief Operating Officer, expanding, adding security to Mr. Shawver, and then adding Dr. Linsenmeyer to the team as an Assistant Vice President. We are moving things forward, and I think we're doing it in an incredibly efficient way, and I so appreciate and value my senior leadership. It's an excellent team. Of course, our academics being led by Dr. Boyd, and then just the incredible work that Leslie and her team does to, recruit new people and to retain them, which is one of our challenges. Certainly, our success ultimately is all about our faculty and staff. It's all about our people. It's all about the work that you do. It is clearly the reason for our success. And the thing that I often point out to people, it's incredible what we do with the number of people we have. Less than 300. Now this doesn't include all the preceptors we have in our clinically affiliated hospitals and clinics, but still under 300, around 300 full-time employees. It's remarkable. It is remarkable what we accomplish here. I know you work hard, and I appreciate it because, it takes a lot, as hard as our students work, it takes a lot of hard work by our faculty and staff to deliver that education and to do all the things that we do as an institution. So again, thank you. It's also about our students. Our success is all about our students, and I'm so proud of our students, not only their academic successes, which are numerous, but also their service hearts, their community service. I mean, just, look at things like the hours put in addition to what they do in the classroom, what they do for their academics. Thousands of hours of service. They raise dollars for organizations in our community, and I know many of you participate in those activities. And again, I really appreciate that. But we are a presence in this community because of this, and I so appreciate our students and what they do for our communities, and then ultimately what they do in the hospital systems in their third and fourth year, and then go on as alumni serving. So let's focus on what I believe is the most critical function and challenge we have as an institution, and that's admissions. That's maintaining our enrollment. First thing I want to say is our admissions staff is unbelievable. I hear it all the time, how welcoming they are. And I think that's a reflection of the culture of this institution. And certainly we want to continue to promote that culture and embrace that culture. But the reality is everyone who's involved in the admissions process, the faculty who serve, the other staff that serve, those who promote the school, this is critical for us. I mean, we are not a school if we don't have students. And so you can see by the numbers that there's still lots of applications. There's a lot of contact being made. But here's something that's a little concerning. 197 new students this year. You know, our number is 200. Every school has a number. It's based on accreditation standards. And we had some weird stuff happening, you know, right as people matriculated, where people at the last minute, you know, did not come to our school. So we're concerned about that. And you know, we're fine financially. Our budget is solid. But what you have to think about is the future. Where are we going? And what does the future landscape look like? And by the way, all of these images, the majority of images that I'm using, and I'm going through this fast because I got a lot to say, but all of these are in the annual report, and we're going to make the annual report available to students. It's already been made available to employees. You can study this and take a look at it. That's why I'm using these images, to get you to take a look at what we've accomplished. I put this slide up because I'm really proud of the admissions staff and all the new ideas, because that's what we need. We need new ideas, new events. These are important. Things like Accepted Student Day, Second Look Day, staying in contact with accepted students so that, you know, it's one thing to get applicants. Then it's another thing to accept your class. And then the third thing is to get them to matriculate, to actually show up and pay their tuition. That's the goal. So I'm really proud of our Board of Governors. You know, they're dedicating money to tuition discounting. And then other incentives. I'm really proud of our foundation and our Alumni Association for creating more scholarships, for obtaining money, current use dollars that we can use as incentives for students to actually matriculate. All of this is important. We had a really good year this year in terms of our West Virginia, number of West Virginia students. We had 50. That's been one of the highest numbers that we've had in a long time. But we certainly have some challenges. But before I get to that, I also want to point out is, where are our students coming from? Well, they're coming from all over West Virginia, but they're also coming from all over the country. About 25%, a little bit less, around 25% is from West Virginia. So 75% of our students are from other states, and we need to recognize that and realize that. They're important. Everybody's important. You can see that we're about 50-50 male-female. And one of the things I'm really proud of is the number of students that are you know, our minority students who are underrepresented students who come to this school. But like I said, we have an admissions challenge. And what is that challenge? Well, we're looking at the trends in West Virginia. And when you look at those trends, what the bottom line is, one, there are fewer students, and you're hearing about this, the demographic cliff everybody's talking about. It's supposed to happen in 25. Well, we're already seeing it. And then there are fewer traditional college-going students in the pipeline. But there's also fewer people who want to go to college. There are few people that want to spend the money to go to college because there are so many other options now. I mean, certainly the undergraduate schools are already being affected. That's why WVU has been in the headlines. Marshall is also having similar deficit problems, and it has to do with enrollment. So that affects us because, well, we're still determining how it's going to affect us, how undergraduate decline is going to affect medical school admissions. But certainly we know that the competition has ramped up between WVSOM, WVU, and Marshall Med Schools. We're already seeing that competition. We know that students will go to these other schools instead of coming here. So that's a challenge for us that we need to work on. But the other challenge is the continued expansion of osteopathic medical schools. And while this is a fantastic thing for the profession to have more DOs in the nation serving, it's creating challenges for the colleges of osteopathic medicine. It's impacting things like enrollment, quality faculty and staff, recruitment of quality faculty and staff, clinical rotations, and then ultimately residencies. And so I think many of you know that Duquesne University has opened up a school. They start this year. One of our major markets is Western PA. Meritus Hospital System in Western Maryland is going to start a school, is starting a school. Again, another major market for our school. We're going to have to identify new markets. I point out, we've had a market with students from Utah. And things have changed because there are now 2 schools in Utah. So what I say to people is there are plenty of medical school applicants out there. We just got to get them to come here. We got to convince them to come here. And we can do that. And we are doing that. So the way we're meeting our admissions challenge is I've recognized that, again, my view is I look out over the next 5 to 10 years. This is critical for us. And so while we're like in the 3rd year of a 5-year strategic plan, I said we need to create a new strategic plan. And we need to do it now. So we've hired an external consultant who is very familiar with the osteopathic world, Josh Mintz, and he's going to be working with us, and you're going to be involved in a strategic planning session this spring, because we need to focus on not just admissions, but other challenges, other things. How do you view this school in 5 to 10 years? What is your vision? And capturing that and moving forward together. So strategic planning is going to be a big part of what we're going to be doing in terms of this semester to try to continue to have a vision for our future. Certainly we want to continue to support our admissions staff and everybody who's involved in admissions. One of the things that I've been working about, and I'm so proud of our marketing and communication staff, because it's about getting the message out there to these new markets. And the market, there's been a lot of change in that department, but they really have coalesced and are an incredible working team that is producing great work that only can help us. Again, it's about getting our message out there, making sure people know who we are and where we are. The addition of Don Smith as our Chief Communications Officer, really important in terms of amplifying our messages, and that's already happening. We need to focus on what makes WVSOM special or unique. Again, there are plenty of medical school applicants out there. How do we get them to come here? It's clear that our campus, or we already know that if we can get them to campus, that's a major selling point. Our culture, our people, I mean, people talk about this. You know, the friendliness of our admission staff, the friendliness of our students and our faculty and staff. We don't want to do this. The quality of our faculty and staff. Our new curriculum, and I'll speak a little bit more about the new curriculum. And then, of course, everything we're doing in simulation, everything we're doing at the Clinical Evaluation Center. And then, of course, our graduate program is obviously one of the ways we hope to increase, be able to secure quality students for our osteopathic medical program. And so I applaud all of this work by so many people. So one of the things that really that we've invested in over the years is improving our video production and improving our social media and improving our presence. So here's a little example, but pay attention to this first video because it'll give you some insight to what our students think special about this school.
One of the major contributing factors to choosing WVSOM was the fact that this campus was not only just made for medical students, which I loved, but also the interviewing process. I really enjoyed the interviewing process as compared to other interviews that I took part in. They really cared about me more so as a person. I wasn't just a statistic, and they wanted the all-around look of me rather than just my grades or my scores and anything. They want to know who I was as a person. I love that about it.
Immediately when I came to Lewisburg, I felt like a part of the community here, like I wasn't just a visitor. And that was true even when I was walking around on campus and getting to know other faculty and students. It immediately felt like home for me.
So when I was touring WVSOM, I absolutely fell in love with the Clinical Evaluation Center. The technology made me feel like this was a super progressive school with really cool simulation labs that would provide me different hands-on opportunities during my first 2 didactic years that would really prepare me for third-year rotations.
So I chose WVSOM. I visited the school before I was accepted back in 2021, and I fell in love with the campus, the community around me. I tried visiting all the local restaurants while I was here, and I fell in love with the food here as well. I think the response that I got was very welcoming, and the campus itself is so beautiful that there's no way I could say no to this.
It's a great video, and it shows it's our people, it's our culture, it's our facilities, all of this, and it's our program. We're doing a lot in social media, and I really, again, applaud the marketing department and their efforts because you have to go where the applicants live. I still love newspapers, but I don't think many of our applicants are looking at newspapers these days, And so social media is really important. And so we're doing a lot in terms of Facebook and Twitter and Instagram, did a little bit on TikTok. This is really critical for us. So I
and
just
with
want to
that,
show
the
this one.
2023 season comes to an end. Good night.
Season rise when I gave the word. Now in the morning I sleep alone. Sweep the streets I used to own.
So visit us on our social media sites and click on it. We have thousands of clicks. We want to definitely boost our numbers. Again, this is all really important. But also, I can't emphasize to you enough, I think the new curriculum will really make a difference. Because I think the dean and the faculty, you're focusing on things that are important to medical students. And you're clearly showing that we want to take care of our students. I mean, I think the emphasis on health and wellness, this has been something that I've been talking about for years, and it applies to all of us. But to create a curriculum where you teach students how to be healthier so that they themselves can be healthier so they can serve, and then to teach their patients is the model we should embrace. I mean, it's the osteopathic philosophy: mind, body, spirit. Take care of ourselves. The focus on the renewed focus on our Jedi track, and looking at issues of diversity in medicine and equity in medicine. These are important factors, that the social determinants of health that need to be understood by our students and be used. And then, of course, we all know about the golden weekends, but now it's like the golden week. And again, walking the talk. If we really care about the wellness and the well-being of our students, we're creating the faculty under the leadership of our dean, Dr. Boyd, and our associate deans and assistant deans are creating that curriculum that truly, I believe, takes care of our students in a way that'll be distinctive. I think the word is distinctive. I used the word unique. We want to be distinctive. And this curriculum, I believe, will make us distinctive. Again, it's going to be up to us, the marketing department and communications, to get that word out, for admissions to get that word out, because I think this will really resonate amongst our students. And so I applaud the work of the dean and everybody who has made this happen. And I understand the challenges. Over 10 years ago, I led the last major curricular change at this school. So we're overdue in a curricular change, but I understand how difficult that work is. I understand what it is to deliver the current curriculum while creating a new curriculum and then implementing that curriculum. So again, I applaud your work. This is another area that really, I think, makes us distinctive, and that is the focus on learning, that interactive experience, on hands-on learning, whether it's using simulators or using virtual reality or the incorporation of ultrasound. I think this appeals, and this, don't get me wrong, I think it's the way to teach medical students. Because it's interactive, it's hands-on, and it helps solidify the knowledge that they're getting in the classroom. So again, I applaud everyone, the work of the CEC and their staff, and everybody who is moving us forward in these areas. I mean, the more you get exposed to virtual reality, the more you realize, wow, what a powerful, powerful learning tool and method. So again, I applaud. We need to continue to do this and do more of it. New facilities are important. And so if you haven't checked out our new testing center, please do. It's open. We'll soon be actually doing testing in there, after we get through February, and we're getting ready for that. I appreciate everyone. This project was long overdue. I appreciate David Meadows' work to get it over the finish line. But there are a lot of people that were involved in this project, like, the work of Kim Ransom and the IT staff, the work of Dr. Linsenmeyer and Dr. Carrier and the testing center staff, Dr. Boyd's leadership in all this. We're finally here. We have the facility, and I thought our building days were over. I've seen a lot of new facilities on this campus over the years, but we're not finished. We continue to grow and develop, and the testing center is an example, and then the new research addition will be the next example. Campus safety. Certainly safety is always important. I mean, I think we've prided ourselves on having a safe environment. But there are new challenges. Our state legislature has passed a bill to allow people to carry concealed weapons on college campuses. Realize this has happened in other states across the country. There have not been increased incidences at these states. I was talking to the president of West Virginia Tech in Beckley, and he worked in Georgia, and Georgia has a campus carry law. And they didn't see very much of an impact. At the same time, we got to protect ourselves. Campus safety is important. It's critical. Nobody wants to be in an unsafe environment. So we're paying attention to this. We are working with experts, and because we recognize that you want somebody who has lots of experience, and so we're working with Command Excellence. We're going to be doing a campus assessment. I believe it's scheduled for next week, so that will be done. Training sessions through Command Excellence are going to be conducted later this semester. Town halls are going to be scheduled in early March. And you may have already heard about this if you listened into the last Board of Governors meeting. The WVSOM Board of Governors has approved moving forward with creating a campus police force, and we're exploring what that's going to take. So again, your safety is important to us, and we are looking at a variety of ways to make this campus as safe as it can be. Growing our research enterprise is also critical for us because it's important to our students, and it's also important to our research faculty. And so like I said earlier, I'm very pleased with the changes in the Office of Research and Sponsored Programs. I really appreciate the new energy that's being put into growing our research enterprise, the work of the faculty, increasing publications, which increases our reputation, increases our visibility, involving students in your research projects, applying for external funding. I applaud all of that. We need to be doing this. It's important to us. I think it's critical to us. It's another thing that we need, that students are looking for. I also want to point out, that the administration has been active of securing dollars to grow that research enterprise. And so we've received a federal appropriation in the amount of $325,000, and certainly appreciate our federal legislators for helping us secure that. Last year, the state appropriation of $29 million. We continue to ask for dollars. So we have currently a federal request at $6 million, and then we've made a request at the state level for $18 million, and focusing on things, not only research, but focusing on deferred maintenance, on capital improvement projects. We're listening to you. We know that we have to refresh a lot of areas. We know that we have to improve the quality of our Founders Center. There's lots of areas. We know that there are water intrusion issues, that there are ADA issues, and there's beautification, need for more beautification on this campus. David Meadows and others are, we're putting together those packages and looking for the funding to get those projects done. And so, again, it's important. The part of the challenge for us is, take Duquesne University's new DO school. Well, it's in a city, so that's attractive to students. But it's the new shiny school, you know? So we need to continue to have new shiny things here too, because that attracts applicants. And it's also important for the recruitment of faculty and staff. Again, I applaud all the work in these areas. You know, another area to consider is what makes WVSOM distinctive is our programs. We have just some fine programs. Our Rural Health Initiative program and the work that they do, and realize that they work with high school students and college students, and then they work with our own students who get selected for that program, and they do so many interesting activities. But we have all kinds of other programs that we've developed, you know, wilderness medicine, culinary medicine, exercises medicine, our graduate school. So the thing is we'll continue to grow this. And I applaud the people who are putting on these programs and those who are dreaming about what the next program could be, whether it's an elective or whether it's a program, a new graduate program, or a new complementary health program. It's all important. This work is important for the school. It grows revenue, which is important, and it brings students to us. I want to just, you know, because we are a leader in rural medicine, I wanted to include this from one of our alums.
My name is Angela Frisbee. I am a WVSOM alumni who graduated in 2016. Currently, I'm an emergency physician here at Greenbrier Valley Medical Center. Rural health is important to me because that means healthcare access and education for the 2/3 of the state's population who live in rural areas. It's also important to me because I live in the community that I serve. It is a privilege to care for our patients who help put food on our table, keep our lights on, and fix things when they're broken, which a lot of the times is taken for granted. I grew up in small town West Virginia, and I know what some of these struggles are like. Our patients deserve to have access and education just as much as any other patients across our state or across the U.S. Who don't live in rural areas.
Rural medicine is our niche, and one of our niches is one of the things that makes us distinctive, and are so proud of our alums who serve in rural areas, whether it's in West Virginia or throughout the country. We are a leader. You know, I can't say enough about what the Center for Rural and Community Health does for us in the community. They are accomplishing incredible things, and they're doing it all through, you know, grant dollars. They really are an incredible group of people. You know, please, you know, if you have interest, you know, go talk to them. You know, they are inclusive, and, you know, our students are involved in many of their projects. And I really think they increase our reputation in the community, they increase our visibility in the community, and they're doing really, really good work, whether it's dealing with chronic disease, the opioid crisis, or, you know, during the COVID crisis. I want to acknowledge our new director, Dr. Brian Hendricks, and if you haven't met him, I encourage you to stop by the Center for Rural and Community Health and introduce yourself to him. He's going to, I really believe, bring our center up to the next level of really involving a lot of research projects, which again should benefit our students and involve our students. You know, I want to do a shout out to Aspire. And admittedly, I'm a little bit biased, but I really believe our counselors, our licensed counselors, and the staff of Aspire, I mean, they're superstars. You know, they do incredible work for us behind the scenes. I mean, look at the number of hours that they're spending with students. And we didn't increase the staff. You know, their SAIL program, and then the tutoring program that has been developed in that group. They really do a lot of great work. But I also want to say to you, they live the mind, body, spirit. And I would say to everybody, we need to take care of ourselves. We need to take care of our minds, our bodies, and our spirits. Aspire's helping our students do that. And I hope you're getting the resources you need so that you can take care of your mind, body, and spirit. It's important work. Self-care is important. I also appreciate all the other offices that help our students, and they're too numerous to list. But I do want to point out, focus on the work of Dr. Dawn Roberts and the Office of Multicultural and Student Affairs. Really important work. And moving us forward, and I appreciate that work, and we'll continue. And hopefully, some of you will get to go to the movie this afternoon. Of course, our statewide campus. Look at the number of hours that our students are providing in terms of healthcare hours. It's just amazing. And then all of our clinical partners realize that we're better together. And so we work with WVU Medicine, with CAMC Vandalia, with Marshall Health Network, with all the rural hospitals, with Boone Memorial, Logan General, Logan Regional. All of them are important to us. And even our own Robert C. Byrd Clinic. And I think one of the really positive things that have come out of this crisis is the recognition and acknowledgement that the clinic is important to us, that it's a place where we train students. It's a place where our clinical faculty practice medicine. It's important for our community, and it's part of the face of WVSOM, even though it's its own entity with its own board. They're having trouble. They're having financial trouble, serious financial trouble, to the point where our Board of Governors had to intervene. And so that's what we're doing. We're doing our part to keep the clinic whole, to keep it viable. And so there have been recent changes, and they've been difficult. There's been a difficult, challenging crisis, but we're meeting it. We're facing it. And I'm so proud of our Board of Governors, but the whole team that's been working so hard on this. My senior administration, every single person has been affected by this crisis. But certainly, the willingness of Dr. Dreama Hill to be the interim CEO, for Mr. David Meadows to be the interim CFO, on top of their regular jobs, they're working 2 jobs. It's a challenge, but we're committed to stabilizing the finances there and making that clinic a success. That's our goal. We're gonna, it's gonna stay as a rural health clinic, at least for now. We're gonna restructure the board. We're gonna immediately work on stabilizing the finances, and then look at what the future leadership is gonna be, because David and Dreama don't wanna stay in these interim positions forever. And then see ultimately what's the best structure for the clinic. Got a lot of work to do. We're up to it. I appreciate the support of the Board of Governors on this. It's difficult work, but we're committed to it because we want this clinic to be a success. It's important to us. GME, the bottom line is the whole purpose for our students is to get through med school so they can get the residency of their choice. Very proud of the fact that we had 100% placement rate. That's where we want to be. And the majority of our graduates are getting the residencies that they want, where they want them. So again, this is critical to our success. The maps are in the annual report. You know, I think the things is just to recognize where our alums practice. You know, 52 of 55 counties of West Virginia. They practice in every state in the United States. Like I said, about 25% of our alums are in West Virginia, 75% are practicing in other states. We're a leader in primary care. We're a leader in rural. And so we continue to lead in these areas. But the other thing that I'm making people aware of is we lead in other areas too. We're not just primary care. We're not just rural. We have alums that go into all the different specialties. And so here's some examples of specialties that they've gone into in the last 10 years. So you can see that the contribution is more than just West Virginia. The contribution is more than just primary care. And the contribution is more than just rural. We're bigger than that. We've grown to be bigger than that. In terms of finances, we continue to be strong financially. We have a healthy reserve. That reserve sits in our foundation. It's an important function of our foundation to those dollars get invested through our foundation, and this is via state statute. And we've grown those dollars. They're state dollars, but they're WVSOM dollars. And that's been helping us out financially. And so realize that the majority of our revenue is coming in through student tuition and fees. Our state appropriation has remained pretty flat. And our expenses continue to rise. So there were a couple of presentations made at the last board meeting that I'll make available to employees, one of which being the proposal that was accepted by RCBC, by our board regarding RCBC. But the other one was David Meadows' analysis of our current fiscal situation. While we're strong in terms of we have a big reserve and we're whole financially, there's some trends that are concerning. That we need to pay attention to, that David is focusing us and the Board of Governors on. And so, you know, what we're seeing is that our revenues are slowing down, that they're only covering 96% of our expenses. They used to cover 111% of our expenses. So we would have a surplus. We don't have that now. That's a concern, because you can see the trend is going down. State appropriations have been flat. Fortunately, we got a $2.2 million increase in 2020. Fortunately, we're getting one-time dollars to build a research addition and hopefully get dollars for deferred maintenance. That will soften the impact on our budget, because we still got to pay for these things. But we clearly have challenges, because what is clear is the state legislature is really not interested in adding dollars to our state appropriation for operating expenses. And they're not interested in doing that for, I think, any of the schools. And some of the schools are in real trouble. We're not. And we want to stay that way. And then our expenses continue to grow. A lot of it has to do with salaries. You know, everybody wants, inflation has been crazy. Everybody wants to improve their salary. We're trying to do that. We're trying to You know, we did market, we've been through a long series of market reviews by HR so that people are at market. What this is about here is that when there's a state mandated raise, we don't get the full amount. Only 64 of our employees are funded by the state appropriation. The rest of our employees, the dollars come from other places like tuition and fees. So when the state mandates, and of course we want to give everybody a raise because of cost of living and so forth, the reality is the state isn't giving us the full dollars to do that. So yes, there's a raise incorporated in the draft budget that has gone to the board. But we didn't get we're not going to get it fully appropriated by the state. That's the point. And then the other thing is just like your households, I mean, everything is costing more, and that's impacting our budget. So one, I appreciate, and I realize it can be painful, the cuts that have been made, the 5% cut across the board, because we want to show the Board of Governors we're being as efficient with our dollars as we can. But at the same time, we have to grow dollars. And we got to figure out how to grow those dollars. Because again, the state appropriation has been flat. The other thing is we've not had a across-the-board tuition increase in over 10 years. And so you can see that by not, because that's the primary way institutions increase their revenue. That's the way other schools are doing it. We've held the line on tuition for a long time. None of us in this room wants to see a tuition increase. But the reality is, it's our major source of revenue, and we need more revenue if we want to continue to be viable into the future. Because this is the trend. And this is from David's presentation. So again, we got to be concerned about this. This is why we need strategic planning. And this is why we presented to the Board of Governors a 5% across-the-board increase in our tuition. And this is the impact. Because we looked at how does that impact us compared to our competition. We'll still be the lowest in West Virginia. And in terms of out-of-state, we'll still be competitive. None of us wants to do this. But again, we want to be strong and viable 5 to 10 years from now. And so we have to start paying attention to these trends now. And we're doing that. And the Board of Governors is doing their part. They are embracing this information and also recognize the school's needs. At the same time, and I'm coming to the end, and I'm sorry this is so long, but I think this is so important. We're growing our scholarship dollars, and I can't say enough about our foundation staff. They doubled. Our annual giving doubled last year in terms of our annual campaign. Look at the new scholarships that have been grown in the last year. Again, I'm having trouble with my pointer, but down here, 6 new scholarships. We continue to do that. And the foundation staff working with the Alumni Association staff, and both staffs, they were understaffed this year. You know, so Donna Meza, Daniel Hamrick, Jessica Lewis in the foundation, and Shannon Warren, I mean, they did an incredible job. Sarah Krickenberger, our grant writer, did an incredible job. It was unfortunate that she left us. This Mayor Foundation right here, I mean, it's a challenge grant. So we raise X number of dollars, they match those dollars and they go into a scholarship fund. But the other thing that the Mayer Foundation has done for us is they give us current use dollars. So that means we can use the dollars now. And those dollars have been so important to us for getting students to matriculate. We've used them as incentives. So the work of the foundation is critical to us for our success, growing those scholarship dollars, growing scholarships for all of our students, working with other foundations, applying for grants, doing all these things are helping to move us forward. And it's so very much appreciated. And we certainly want to welcome our new additions to the staff, Sheldon Mullins, who's going to be our development officer, and then the return of Mark Van Buren in our Alumni Association office as our alumni officer. And as I said, the Alumni Association under the leadership of Shannon Warren, I mean, the job of the Alumni Association is to connect us, keep our alums connected to the school. And then it's the job of the foundation to encourage them to give back to the school. And again, I applaud the work of both the foundation and the Alumni Association staff. And I'm excited about the future as we continue to grow our dollars. But realize that scholarship dollars are helping students. The money that they're bringing in helps students, it helps the school, but they don't help our operating budget. So in conclusion, again, I want to say thank you to everyone for all of your hard work. We are a success. We are in a very good position. We are ready to meet our challenges. Nancy and I, we are truly blessed by being part of this community, by being part of this school. We so appreciate you. And I want to end with this, because this is what it's all about. Thank you, everyone. Have a great rest of your day.